Okay, hopefully this works. Hi, I'm Jaclyn Nunziato. I'm an OBGYN at Carleon Clinic, Virginia Tech, and I am also the executive director of Huddle Up Moms. I cannot be more excited today to talk to you and be part of this Pregnancy and Postpartum Resource Summit as a pre-recorded workshop. Today, I will be talking about the 411 of the fourth trimester, which is truly one of my huge passions, both in my career and as the director of Huddle Up Moms, because I think it's something that is not talked about enough. I think that I could probably spend an entire resource summit on the fourth trimester alone, but I am happy to try and squeeze everything into the next 45 minutes. Hopefully you'll find this educational. So every time we do a lecture or a presentation, we always talk about disclosures. Do I have any bias about what I'm talking about? And normally this more talks about if anybody is paying you to record, if you have any sponsors. So for this particular workshop, I don't have any. But I have to say that I am recently postpartum for the second time. I have two beautiful baby girls. And so I am 100% biased. Not only am I a woman, not only am I a mother, a daughter, a wife, an OBGYN, but I am a huge advocate for women's health, maternal health, and empowering women. So yes, that is my full disclosure. And then finally, before I get started, people always ask, why I go into this field or why I do this. And it's so easy for me, really, because it's all about the ones you love, right? Without a supportive team around you, you wouldn't be able to thrive in your community or thrive in your life. And I feel so passionate about this cause because of all the people that I have surrounded by me. So all of these guys right here are little either nieces, nephews, godchildren. I'm lucky to be the godparent and lucky to be an aunt. I have so many cute babies and a mother myself. And I posted these pictures because it always keeps me motivated about improving maternal health in general. Okay, so at the end of this lecture, hopefully you guys will, or the end of this workshop, hopefully you guys will be able to know what the fourth trimester is. Definitely one of the big goals. And I want you to be able to understand the importance and the awareness about the fourth trimester. And then I want you to be able to list and describe the B's of postpartum. For each topic, I hope you will understand what is not normal about the postpartum period. And then I really want you to understand the importance of building your support team, because you can't do this alone and you're going to need help. And sometimes it's hard to know what you don't know. And so hopefully you'll be able to do that by the end of this talk. As a disclaimer, these workshops in general today, and mine specifically, are not meant to be medical advice. They're meant to be informative and they're meant to be educational. They never substitute for medical advice from your provider, because the best and hardest thing about being pregnant is that it's actually so unique and so different for every individual and each pregnancy, that the most valuable care that you can get is tailored and individual care. And so these really are meant to be educational topics or topics that pique your interest to really learn more about or to ask your provider about. Let's go over some quick definitions. So postpartum, in the United States, this is considered the period between delivery of the placenta and 42 days after birth. The postpartum visit, which is usually about 6 weeks after you deliver, only about 60 to 70% of women return for this visit. And the average postpartum visit lasts less than 10 minutes. And there are a number of significant barriers. When I talk to my patients about why they don't come, some of them have a limited understanding about what we do at this visit. Some of them are just overwhelmed. Some of them can't get childcare, lack of insurance. There's so many barriers. And this is such an important visit. And we really want to change the emphasis on why it's important to seek healthcare professionals after you deliver your baby. I know what you're probably sitting there thinking, the same thing I've thought since I became an OBGYN. How could the postpartum period only be 42 days? And I didn't really truly understand this until I had my own babies. And then I knew for sure that Nobody feels like they're back to their normal selves in 42 days. It doesn't matter what type of health condition you are in prior to giving birth, you need to have more time, because the postpartum period, which is what we believe, and the fourth trimester is really about taking care of yourself and the baby and you as a family for at least a focus on the first year. So again, the fourth trimester is a new paradigm where we have postpartum comprehensive care. It's a new perspective that really takes care and focuses on not just the mother, but on the baby, on the entire family as one unit or a dyad. Right now, if those of you who don't know, if you look at the prenatal care here in the United States, there are about 14 visits where you get to seek a healthcare professional, whatever type of professional that may be. The fourth trimester is about taking that and balancing it, because we only have one visit postpartum, and it's not for 6 weeks after you give the delivery. We are doing a huge disservice, I think, not educating our mothers. And that has shifted within the last couple of years into really focusing on what to do once you get home with your baby. And so the fourth trimester is really this balance. How can we take the 14 visits that you have prenatally and balance them with one visit postpartum? How can we get the most bang for your buck? How can we take all of those visits and educate you in order to have a preventative, comprehensive postpartum care? I love this diagram. So there are a number of leaders in the community, including North Carolina, who have come up with their own fourth trimester platform. And this really talks about all the different components that need to go into the fourth trimester. And as you can see, and if you remember what I was talking about earlier, the postpartum period right now has a short amount of time. The postpartum visit has a short amount of time where you can talk to your healthcare provider. And so it's really important that we address all of these things while you're pregnant. So medication and substance abuse, substance exposure, mood and emotional well-being, infant care and feeding, sexuality, contraception, birth spacing, sleep and fatigue, physical recovery. Really, the list goes on and on. I don't think that there's a diagram big enough to all the things that you want to focus on in the postpartum period. I love this cartoon because, and someone gave this to me a couple years ago, but if you're like me and I'm an OBGYN, you may be at home thinking, all right, I prepared, I read every book, I read what to expect when you're expecting from front to back, 5 different times. And then you have a baby and you think, now what? Right? You get the baby and all of a sudden this anxiety sets in because you don't know, and most people don't feel prepared. And so really the fourth trimester is about how over the 9 months of your pregnancy can we prepare you for feeling more comfortable as a mom. So the postpartum issues no one talks about. It's interesting to me that there's even infographics about this, because if you think about the number of women that give birth every year in the United States alone, which is about 4 million births, that means 4 million women are postpartum and not talking about the issues that they're having. That can't be, and it needs to change. And so that's really what this conversation is all about. Mothers experience a new onset of health problems in the first 2 months, and it can last up to a year in the postpartum period. And these things are maybe not discussed. And so I urge you to talk to your healthcare provider about that. The postpartum blues, excessive hair loss. If you look at these numbers, they're kind of startling. The feelings of depression, we'll talk about that in more specifics as we go on, but over 40% of people have a lack of sexual desire. Over 50% of people have issues with their breast that are well beyond just breastfeeding. Over 50% of people feel physical exhaustion, sleep deprivation in over 60% of people, heavy bleeding in over 20% of patients, backaches in over 50% of women, hemorrhoids is another big one, bowel issues, weight control issues, which can last, a significant time period after the first year. These are all things that need to be addressed because, as you know, if you're a new mom or a mom in general, once you become a busy mom, it's so hard to take care of yourself. And so while you're pregnant, it is the perfect opportunity to focus on yourself, on how you can be successful in the postpartum period. Why is this important? Such a good question. There's a million reasons why, but maternal health and mortality is a real situation, and the World Health Organization has made it their mission to increase awareness about a significant problem across the globe, and that's women that are pregnant and within the first year of delivery are dying, and they're dying from preventative causes. And this is really about awareness. So around 30% of mothers, patients are dying from pre-existing medical conditions, diabetes, HIV, obesity, high blood pressure, things that really complicate the pregnancy. 25% about are dying from postpartum hemorrhage and bleeding. In this country, it's about 8%, and we'll talk more about that. What I want to focus the attention on is that the majority of these patients that are dying, mothers that are dying, are actually dying in the postpartum period, where new numbers from the World Health Organization show that up to 45% of women that are dying across the globe are dying in this 42-day window. Which you can see is an issue because we don't see patients normally in that 6-week window. So what can you do to change that number, right? Remember, we want balance. We want to optimize the current healthcare system by focusing our attention on postpartum care in the antepartum or during your pregnancy. Here are some facts that you need to know. More than 700 women in the United States die of pregnancy-related complications. And nearly 50,000 women in the United States have what is caused an increase in mortality and morbidity, so almost a near-death experience. Black women are 4 times more likely to die from pregnancy-related complications. 60% is the new number of these deaths are preventable. It's really challenging in the United States with our healthcare system, but at this point, we just need to focus on what we can do in the current metrics, right? And with that, we are one of the only industrialized, developed countries where our maternal mortality rate is increasing. We need to take a stand, and we need to focus on what we can do better. And it's up to you, moms, to do that and work with your team. So 42 days after your delivery can influence the next, I'm just trying to keep track of the time. 42 days after your delivery can influence the next 42 years of your life. I love this little picture because, and again, this is from the 4th trimester from North Carolina, but a lot of women don't know that the problems that you can have in pregnancy are really a window into your health in the future. And a lot of those things are preventable if you take action soon after your delivery. So 70% of gestational diabetic patients, so problems in pregnancy, diabetes only in pregnancy, will develop type 2 diabetes in the future. So it's a very important thing to tell your primary care physician, is to tell them anything that you've had that have complicated your pregnancy. When you turn 40 or when you turn 50, it's something to bring up at each visit because that can increase your risk significantly. The same thing with gestational hypertension and with preeclampsia. It increases your risk of cardiovascular disease tremendously in compared to the general population. And excessive weight gain during pregnancy that stays in the postpartum period can also complicate your health. So let's talk about the B's of postpartum. That's what I call them. They don't all fit into this perfect puzzle piece, but it's an easy way to remember them. I teach the residents and the medical students this all the time. And then we're going to kind of talk about some warning signs. Like I said, I could talk probably about each topic for hours at a time, but we're going to try and hit some key points. These are the blues: bleeding, blood pressure, breast, bottom, boinking and birth control, blood clots, bowels, bladder, and baby. Easy to remember, right? The first one. So what I love about this resource summit also is that we are going to have a number of providers that will be talking about each of these topics. So stay tuned. blues and postpartum depression. So 10% of 4 million live births, that's 400,000 women every single year are suffering from postpartum depression in the United States. And that is underreported because that number does not include the 300,000 women that are suffering from postpartum depression because the loss of a birth or pregnancy. This is a topic that needs to be talked about more, and I'm so glad that it's getting as much publicity as it is with recent events in the news. But it is worth discussing, especially in a conversation like this. In this vast majority of women, only 15% are seeking treatment. And there's a number of reasons and a number of people doing research right now as to why that is. It's so hard being a mom and wanting so badly to have children and to have these feelings. There's so many different factors that play into it. Isolation, especially in these COVID times, dealing with infertility issues, and then finally getting the baby that you have always wanted, changes to your relationship, physical changes, hormonal changes, sleep deprivation. There's so many reasons that you can have postpartum depression, but there is a shame to coming forward and admitting that that's the case, and there really shouldn't be. And so we really want to make it known that we are here for you to support you. And if this does pertain to you, call a friend, call your family, talk to your significant other about it, or call your healthcare provider. So one of the big things right now too is that we're really trying to get away from just the term postpartum depression and make it all encompassing to include perinatal mood and anxiety disorder. About 10 to 15% of patients experience postpartum depression. About 80% of patients will experience postpartum blues in the first 2 weeks. But about 30% of patients will actually experience depression throughout the pregnancy, which is supposed to be the happiest time of your life, right? So no one ever pregnant. Because it's hard and it's, that doesn't mean that you're not happy or pregnant. It just means that your body is going through a lot of changes and there's a lot of anxiety and worry that's surrounded by it, and that's okay. So perinatal mood and anxiety disorder encompasses anxiety, panic disorder, bipolar, postpartum psychosis, obsessive compulsive disorder, post-traumatic stress disorder, and depression, a much larger encompassing mental health awareness needs to happen. So 1 in 7 pregnancies women can experience postpartum depression. For first-time mothers, that's a 7.3% increase in risk. For women that have experienced postpartum depression, you are at a 50% chance of having it again. So please, please, please tell your healthcare provider about it at your first prenatal visit or bring it up at any of the 14 visits that you have. And I want to also address that these aren't just changes that are happening to you. Yes, physically, and some of the hormonal changes are happening to you, but they're also happening to your significant other. And if you look at the numbers, I think this is a very under discussed topic because about 10% of fathers within the first year can also experience postpartum depression. There are a lot of changes that happen between the relationship. And unfortunately, I don't have those numbers for other types of relationships, but I think there's a ton of studies coming out about this topic specifically. So again, perinatal mood disorder, we're talking about the umbrella topic here. So just to kind of go over quickly, postpartum blues. So this is crying, feeling like you're not yourself, impatience, irritability, restlessness, anxiety, worrying while your baby's sleeping, if the baby is breathing and not being able to sleep yourself, poor concentration, mood changes. These should really only last 2 to 4 weeks. And still, just because it doesn't last long doesn't mean that you shouldn't seek care or support or professional guidance about that. And then for postpartum depression, difficulty sleeping, lack of energy, low sex drive, changes in appetite, weight loss, feelings of inadequacy, hopelessness, despair, feeling guilty, which I know is a huge one, difficulty concentrating. I listed here a couple of resources, but please reach out to your healthcare provider for other ones. Postpartum Support Virginia is giving a talk during this summit. and they're a wonderful resource. And so is Jennifer Wells in the psych department over at Curlian. There are a number of amazing social workers in the area as well. And then I put one of the national resources, the Substance Abuse and Mental Health Services, which is a 24-hour hotline that you can call if you have any issues. Okay. Like I said, I wish every time I do one of these talks, I think I wish I had so much more time, but these are kind of just teasers to get some information to you guys. So the postpartum hemorrhage, bleeding is another one that is a concern for the postpartum period. So postpartum hemorrhage is excessive bleeding after delivery. 15 out of 100 people may experience this, or about 8% in the developed countries. If you look at the reason for maternal deaths worldwide, it's about 25%. And these are one of those big ones that are preventable with good education, some changes in our healthcare system, and better communication. So about 14 million people around the world suffer from postpartum hemorrhage. And if you're thinking about why that is, so some of the causes, so the biggest cause is when your uterus fails to contract. You can also have tears on your cervix. You can have a placental issue. You can have a hematoma, or a blood accumulation of blood that is hidden. It usually happens immediately after delivery, but it can happen up to 12 weeks. And some of the risk factors include infection, obesity, prolonged labor, bleeding, high blood pressures in pregnancy and operative delivery, and having placental issues like placental previa. So some quick facts. It's so hard as a mother, and I know this, it's easier for me as an OB/GYN provider, but still when you're going through it, it's hard to know what's normal and what's not normal. And I would always encourage you that if you know your body best, if you think that your bleeding is abnormal, call. Okay, call your provider, call your doula, call your midwife, call the office just to check and make sure that everything is okay. Page the nurse if you're still in the hospital. So lochia is the bleeding that you have close to delivery. So day 1 to 4, it's usually dark red. It's a heavy flow, period-like. It changes when you get out of bed. It changes and increases when you are breastfeeding, because your uterus is contracting because of the hormones that are released. From about day 4 to about day 10, it should get less. There should be fewer clots. From day 10 to 28, it should change and become lighter. You should have no more heavy, bright red bleeding. There is a picture there about pad counts. So really important. If you are, as you progress, you should be going to the left of this picture. So the first day you may be saturating a pad, but as the postpartum period goes on, it should be less and less. If you ever have a change where you are bleeding heavily after you've been not bleeding, that's always a sign that you should call your healthcare provider. So red flags. If your bleeding slows or stops and then starts again, so that's the one I just said. If you're soaking through a pad an hour, never normal, call right away. If you're passing larger clots that are bigger than 2 inches in diameter, if you have fever or flu-like symptoms associated with the bleeding, or you have severe abdominal pain outside of the normal kind of cramping when you are breastfeeding. So blood pressures in pregnancy. There are a couple of different types of blood pressures in pregnancy, but preeclampsia is when you have severe range blood pressures in pregnancy, and you also have a sign of that the blood pressures are affecting your overall body and perhaps other organ systems. Gestational hypertension is when you have mildly elevated blood pressures in pregnancy without all the other signs and symptoms. And these issues complicate about 8% of all pregnancies. Some signs and symptoms of preeclampsia specifically. So a severe headache that won't go away. It's not your average migraine or your average headache, tension headache from stress. It feels like this pulsating sensation. You take a Tylenol and it doesn't go away. You may have swelling of the hands and face, or swelling of your extremities that happens all of a sudden, that is outside the range of normal swelling in pregnancy. Weight gain, if you're gaining, weight overnight, that's a big one. If you have difficulty breathing or chest pain, you're gasping at rest, nausea or vomiting in the late third trimester, changes in vision, blurry vision, spots, flashes of lights, and then upper belly pain. That is kind of a burning sensation that could radiate to the shoulders. So preeclampsia awareness, this is so, so important because like we talked about earlier, blood pressures in pregnancy are a large contributor to the maternal mortality rate or the death rate in the United States and across the globe. So I want everybody to really focus on these numbers because they're so important, because this is really about raising awareness. So 44% of women, when they polled across the country in 2014, did not know that you can have preeclampsia after delivery. Yes, you can. I know that from firsthand experience. You can actually have blood pressure issues afterwards. So if you're home and you're experiencing any of these, call your doctor right away. Do not wait for your 6-week visit. Call and let somebody know. 46% of women did not know that preeclampsia actually can cause health problems in the future and increases your risk of cardiovascular disease. So always tell your primary care or another doctor when you're filling out those medical forms, which I know everybody hates, but they're so valuable and people don't fill them out correctly because they don't know what's important. So any complication of pregnancy is important when you're filling out that paperwork. 88% knew that high blood pressure was a sign of preeclampsia. You know, that blows my mind and makes it really speak to the fact that we need to do a better job with letting people know that that's what preeclampsia is. It's blood pressure issues. And only 83% of patients have heard of it, not know what it is, but have heard of it. So we really, really, really need to change those numbers. So some quick 10 quick facts. So the latest research shows that a baby aspirin, 81 milligrams, starting at 12 to 16 weeks, can help prevent preterm birth and preeclampsia. So talk to your healthcare provider if you think that you may be at risk. Only 50% of women that are educated are informed and understand the signs of preeclampsia. 1 in 12 pregnancies will be affected. 66% of patients will die of cardiovascular disease in the future if you don't do something about this. So you are at risk. Ask your doctor what you can do to lower your risk factors. Premature birth, low birth weight, and death are all risks of preeclampsia. And preeclampsia doubles your rate of having cardiovascular disease in the future. You're also 4 times more likely to have high blood pressure. And then we talked about it, but 6 to 8% of all pregnancies in the postpartum period are affected by preeclampsia. And it is one of the leading causes of maternal mortality with 76,000 deaths worldwide. And it also causes 500,000 infant deaths. Tell your provider, right, is the gist of this slide. So the next one is breast issues or mastitis. So 1 in 10 women have, this could be a topic all in of itself, right? A lot of these can, and there are so many different conversations that are going to be happening at the Pregnancy and Postpartum Summit about breast issues and breastfeeding, but I wanted to specifically talk about mastitis in the postpartum period because these are more warning signs or things that you need to really call your healthcare provider about. So 1 in 10 women have mastitis, which is an infection and inflammatory process of the breast. It is, the signs and symptoms are breast tenderness, warmth, redness, thickening of the breast tissue, pain, a burning sensation while you're feeding, fever, and flu-like symptoms. It's so hard. And I think right now with COVID, so the big one is that flu-like symptoms can actually precede the mastitis or the physical findings that you can find. And so it's really important that if you have a fever or you're overall not feeling well, that you call, especially if you're having issues with breastfeeding or you know that you have a clogged duct. So some of the risk factors are prior history, cracked nipples, missed feedings, wearing bras that are too tight. Women, mamas out there, got to invest yourself in some good breastfeeding bras. That may change throughout your postpartum period as you wean yourself off of, breastfeeding. yeast infection or a baby thrush, a sports bra or starting to exercise, sleeping on the affected side, an improper latch or tongue ties. And again, always call your healthcare provider. So one of the other things is that you can get fevers, really high fevers, 102, 103. So really make sure that you're seeking care. And then one of the things that is important to know is a lot of women think that they can't breastfeed while they're undergoing this issue, but you certainly can. You can still breastfeed on the affected breast, and you can also pump if you feel more comfortable. You should actually pump as up to every 3 hours, so that way you are getting enough letdown and you're not clogging on that side. And this issue does require antibiotics, so please seek professional help. So your bottom, which is laceration and C-section. So in general, this is definitely something also to call or seek healthcare guidance for. But in the United States, 1.3 million C-sections are done a year. The new numbers out are projected in 2020 to be lower, which is so great. The average is about a third of C-sections. They're thinking the projection this year will be about 22%, which is wonderful, but still, because there's 4 million births in the United States, it's still 1.3 million. And so we really need to talk to mothers about how they can take care of their wounds. 50 to 80% of women will sustain some type of vaginal laceration, which is so important because you need to be able to know how to take care of these lacerations. So warning signs and when you should seek professional help. So fevers that are greater than 100.3, redness or oozing from any of the incision, if you feel or you see that the incision is open, if you have pain that worsens at the incision site, or if you have any redness around the incision, if you find or you feel tearing with movement at the laceration, or if you have any foul smelling discharge, all of that not normal. Things, a whole nother lecture on things that can help prevent vaginal tears. So please look that up. But really important that you seek healthcare assistance if you experience any of these. And then one of the things I talk to a lot of patients about, so it's not normal to have pain after intercourse. Things that are normal, things that are common are not normal when it comes to postpartum. I think there's a big misconception there. And so it's really important that you talk to your healthcare provider, and it does not have to be, if it's within the first year, if it's outside the window of your postpartum visit, still really important to call, because it's important to be intimate with your partner if that's what you desire, and you want to be able to have that relationship. And I talk a lot about this in my visits if you've had a visit with me, but vaginal birth in general, or C-sections in general, if you were an athlete and you were going through trauma, or if you had a sports injury, you would rehab, you would go to a therapist, you would rest, you would isolate, you would take care of the injury. And now you think of the vagina and the vaginal birth canal is the same muscles, tendons, ligaments, nerves as the rest of your body. It's just not talked about as much. And so it goes through its own birth injury, birth trauma, even if you don't have any lacerations. And so there are a handful of patients that will require more care, that may require specific physical therapy for the pelvic floor or for the vagina or for tears, that may need rehab and things like that. So, do your research about that and ask your healthcare provider about that. Okay, for lack of better words, blanking birth control. This literally is a topic in and of itself, and many topics. So I will just quickly go through it. But nothing inside the vagina for 6 weeks is what we recommend. Wow. We know that that is not true, and that many people, about 40% of women actually, report having intercourse before their 6-week appointment. And so it's really important that we talk about this during your pregnancy and not wait till afterwards. The average postpartum woman, regardless of her breastfeeding, actually ovulates at day 74 of delivery. So be careful, because 47% of women are still reporting unintended pregnancy rates in the postpartum period. If you are breastfeeding and you're worried about your birth control options, the progesterone only pill or the mini pill, the depot, and the IUD are things that have been proven to not negatively impact your breast milk. Now, this is different for everyone, and there may be a slight decrease, but definitely talk to your healthcare provider about those specific statistics. And then this is just a little bit of some information about the different types of birth control options you can have. The most important thing about this topic is, or that the most important thing I can say to everybody out there is really talk to your healthcare professional about this before you deliver. I know that we talk to women about this before they leave the hospital, but there's so much information that we're providing you. Women aren't sleeping in the hospital the first couple of days. And so that's not the time to discuss these. You really want to discuss these things before they're an issue, right? Sorry, we're closed. This is just my soapbox for if you don't want to be pregnant, you should not be pregnant. And so it's really important that you address these issues with your healthcare providers, okay? And then Mythbuster, you cannot get pregnant while breastfeeding and pumping. We all know that that's not true. So really just make sure that you're taking good precautions. Blood clots. So this is another big one. So women who are pregnant are 4 to 5 times at fold increased risk of blood clots compared with non-pregnant women. And it accounts for 10% of maternal deaths in the United States. It only accounts for about 1 to 2% out of 1 to 2 out of 1,000 pregnant women. So not a high population, but really important to know the warning signs. So swelling, cramping, swelling in usually one extremity versus overall swelling, which is kind of normal in the postpartum period. If you have cramping or pain, especially in the calf area, sometimes you may have redness over the area. If you are experiencing chest pain, a cough, chest pain and shortness of breath in pregnancy, especially while you're at rest, is not normal, and you should always call 911 or a healthcare provider to seek assistance. Bowels and bladder. So 25% of women report hemorrhoids postpartum, things that people never talk about. And 30% of women report issues with urination. Again, just because things are common doesn't mean they're normal. Less than 10% of women report talking to their providers about these. And that's why these workshops and these conversations are so important. Solutions for things like this: pelvic floor therapy, Kegel exercises, Tux pads, witch hazel, cold packs, and sitz baths. So things that can kind of help, tips to avoid pelvic floor dysfunction. So perineal massage, that can happen during your pregnancy. Taking labor classes and going to workshops and summits like this, so you can educate yourself about pushing. Your posture is so important throughout the pregnancy. Many women don't seek exercises or fitness during their pregnancy, and it's so important to optimize the postpartum period. Nutrition is important, exercise. There's been some great studies that have come out recently that have emphasized that exercising about 150 minutes per week in a mild to vigorous form during your pregnancy is so important for overall health status and for regaining some of that postpartum, or sorry, for losing some of that pregnancy weight. And finally, but not least important, the baby. Again, I will let others in this summit speak about this, but really the postpartum period and the 4th trimester is about treating the mother and the baby as a dyad, as one unit. It's really about connecting and bonding with your baby. And if you feel you're not doing this, please call and ask for support. And then finally, but again, not, not least important, it takes a village to raise a child. And this is why we wanted to have this resource summit. You may be trying to figure out who your village is. And so I wanted to help you with some quick tips about who that can be. So the community. Build your community around you. It's so important because we already said 4 million women in this country are new moms, already existing moms, becoming moms, and you could use other moms to help you. And there are so many resources in this community. Your partner, very important that you plan ahead, plan with your partner, feel supported by your partner. And so, really, it's important to discuss all the changes that you're going to have in your relationship. A doula, such a great resource. OBGYN, family practice provider, pediatricians, midwives, lactation specialists, nutritionists, mom groups like Huddle Up Moms, there's my plug, friends and family, birth educators. These are all people that you can build over the 9 months of being pregnant. You should seek out those that you are going to build you up and support you when you become a new mom. Fitness experts, I left that one out. Sorry about that. And finally, let us give you the support you need to thrive. So, as an OBGYN myself, I always struggle with the fact that I can't be everything for my patients, but I want to be. And one of the things I love about being a strong advocate for other groups in the community is that together we can be the support that you need. So let us give that support to you so that you can thrive in the community. So I just wanted to get on. There are too many logos to include on one slideshow, but these are just some of the many providers in the community that have come together to support you. And hopefully you'll learn about that more during this resource summit. And then finally, I wanted to thank my family specifically my partner, my husband, because without him, I would never be able to do all these crazy adventures that I want to take on. Wonderful husband and father, and so supportive, and such a great dad. He watches those kiddos all the time when I'm doing crazy things like making this video, when I am taking care of my patients and on call, and when I am trying to build nonprofits from scratch. So thanks so much, babe. For all of you moms out there, if you have gotten anything out of this video, that is really the goal. It's really just to educate yourself and to feel empowered, because we not only want this pregnancy to be for you to feel empowered during this pregnancy, but we want you to feel empowered in the postpartum period in that 4th trimester. So it's worth doing your homework and learning more about how you can do this. And we can help you do that. All right, I know that I'm going over time, so I will get going. But thanks so much and hope to see you soon. Bye.